Hi guys, it's Dr. James from Vets of Geelong, and today I'm talking about Cushing's disease. Cushing's disease is a disease which affects humans, predominantly dogs, extremely rare in cats. So today I'm concentrating on how it affects dogs. Typically, Cushing's disease is an overactive adrenal gland, often referred to as hyperadrenocorticism. It can also be associated with the pituitary gland as well. What tends to happen is animals present to the vet team with a history of perhaps drinking more than normal, urinating more than normal. Their appetite may have increased, they may have become pot-bellied, they may have a poor coat or a dull coat. They may also have, sometimes their coat just doesn't look as glossy or hasn't grown back as it normally would. Typically they just look a bit run down. Often occurs in older patients. So what happens? Often what happens is the vets have a suspicion of Cushing's disease based on what you're describing, and also a suspicion based on clinical exam. And there might be circumstances where they recommend specific types of blood tests. Typically those would often associate with an ACTH stimulation test or a low-dose dexamethasone suppression test. Both those tests can be used for different circumstances to diagnose Cushing's disease. Occasionally we need to do both tests if result is a bit questionable. Once we get a diagnosis, typically there is a treatment which can be given. So for most patients, we tend to start them on a medication referred to as trilostane, which is the active ingredient. And typically those patients make a good recovery and go on to be, quite normal. And that would be the treatment for most of the patients. Typically, once they're up and running, they have a blood test about 2 weeks down the track to make sure they're coping okay and we haven't pushed the adrenal glands to go too low. The next thing would be then, once we get to an ideal dose range for your pet, typically they have blood tests spread throughout the rest of their life, approximately every 6 months or less if they're a little bit unwell. So, in a nutshell, if you're worried about Cushing's disease, you've heard about Cushing's disease, or perhaps the vet says, this vet looks like it's a bit Cushing or we might have to consider blood tests, that's probably why they're considering it based on the history and the clinical exam. If you've got any more questions, feel free to reach out to the team when your pet's next in for a visit. Take care guys, bye.